Hello, let me introduce you to ECG Buddy. ECG Buddy is an AI-powered software designed for 12-lead ECG analysis, which has received regulatory approval as a medical device from the Korean Ministry of Food and Drug Safety. It can be used in various ways, such as being integrated with electronic medical records, capturing 12-lead ECGs via smartphone, or capturing ECGs displayed on a desktop PC screen. The smartphone and desktop software are available for immediate download from the app stores. Currently, it is available for research purposes only outside of Korea, but we are in the process of obtaining regulatory approvals in various countries for broader use starting next year. ECG Buddy classifies heart rhythms to diagnose arrhythmias and provides 10 digital biomarkers to screen for various emergencies and assess cardiac function. ECG Buddy can classify a total of 11 major heart rhythms, and when combining these with pulse rate information, it can distinguish around 20 different heart rhythms. This capability allows the system to provide information on conditions that are often misdiagnosed by machines, such as atrial flutter 2-to-1 block, ventricular tachycardia, and atrial fibrillation with WPW syndrome, helping medical professionals better manage arrhythmia-related emergencies. ECG Buddy provides 10 digital biomarkers that can be used to screen for various emergencies and assess cardiac function. These biomarkers help evaluate the patient's overall hemodynamic stability, identify high-risk myocardial infarctions like ST elevation, myocardial infarctions, and equivalents, and provide a comprehensive evaluation of various cardiac functions. Additionally, they can also be used to screen hyperkalemia. The biomarkers in ECG Buddy are displayed on a graph with a score ranging from 0 to 100. Each score is categorized into one of 4 levels: low, moderate, high, or very high, with these categories displayed in the background of the graph. The low-risk range is defined as achieving a sensitivity of 95% for STEMI, 90% for ACS, LV dysfunction, and hyperkalemia, and 80% for the remaining conditions aimed at identifying low-risk patients. Conversely, the highest risk range is defined to achieve a specificity of 99%, aimed at accurately identifying high-risk patients. When interpreting ECG Buddy's digital biomarkers, clinical background information of the patient must always be considered. ECG Buddy analyzes standard 12-lead ECG waveforms obtained from adult patients, performed at a speed of 25 mm per second and a scale of 10 mm per millivolt. Digital biomarkers can be affected by various external and internal factors, so please make sure to review the IFU, instructions for use, document thoroughly before use. This slide shows an example of the supported 3x4 standard ECG format. The lead arrangement shown in this example must be strictly followed, and each 2.5-second waveform segment should not be too wide apart. The bottom rhythm strip is optional. If present, it must be lead 2, V1, or V1/lead 2/V5, 3-lead configuration. If not, manually exclude the rhythm strip area during analysis. This slide shows an example of the supported 6x2 standard ECG format. The bottom rhythm strip is optional, but if present, it must be lead 2 or V1. Otherwise, manually exclude the rhythm strip area during analysis. This slide shows an example of the supported 12x1 standard ECG format. The classification performance of ECG Buddy's 11 heart rhythms and 10 digital biomarkers was demonstrated through a clinical trial involving 9,355 ECGs, approved by the Korean Ministry of Food and Drug Safety in 2023. In addition to this clinical trial, we have conducted various validation studies to prove ECG Buddy's capabilities. ECG Buddy can detect various STEMI and STEMI equivalents with equal or greater accuracy compared to cardiologists. Its accuracy, comparable to that of experts, has also been confirmed in the analysis of pre-hospital ECGs and post-resuscitation ECGs. Recent studies have also validated ECG Buddy's biomarkers for left and right ventricular dysfunction as well as hyperkalemia. Now, let's take a look at examples of actual patient ECG analyses. This case is an anterior STEMI, with the STEMI biomarker reaching the maximum level, indicating a strong suspicion of STEMI. The ACS and myocardial injury biomarkers are also at their peak. For non-STEMI cases, only the ACS and myocardial injury biomarkers would typically increase. In cases of atrial fibrillation with RVR, left ventricular function assessment plays a crucial role in determining medication for heart rate control. If left ventricular contractility is suspected to be reduced, as in this case, it's best to minimize the use of medications that affect myocardial contractility. Additionally, ECG Buddy provides pulmonary edema biomarkers alongside left ventricular dysfunction, aiding in emergency treatment. In acute pulmonary embolism, PE, assessing patient stability and right ventricular dysfunction is critical for deciding on thrombolysis or thrombectomy. In this case, ECG Buddy indicates that the patient is unstable, with both right ventricular dysfunction and pulmonary hypertension. Biomarkers can also be used to assess chronic conditions, as seen in this case of primary pulmonary hypertension. The RV dysfunction and pulmonary hypertension biomarkers are elevated, while the critical biomarker is not. This case involves acute pericarditis complicated by cardiac tamponade due to pericardial effusion. ECG Buddy biomarkers indicate that the patient is unstable, with a high likelihood of non-ischemic myocardial injury and significant pericardial effusion. Hyperkalemia is often asymptomatic or presents with non-specific symptoms. Without appropriate emergency treatment, it can lead to life-threatening arrhythmias. ECG Buddy allows you to assess the risk of hyperkalemia from an initial ECG, and if the risk is high, point-of-care testing, POCT, for electrolytes can be used to confirm and initiate immediate treatment. Although ECG Buddy was recently launched, it is already being widely used in various clinical settings. It is being utilized to activate the cath lab for STEMI and high-risk ACS patients, as well as for early discharge of low-risk chest pain patients. It is also used to evaluate cardiac function in patients presenting with syncope and to rapidly identify patients with suspected heart failure and pulmonary edema for diuretic administration. However, clinical evidence for these specific use cases is still limited, and further research is required. We look forward to your feedback and opportunities for collaborative research. Thank you for your attention. If you have any questions, feedback, or collaboration opportunities, please feel free to contact us via email or phone.